Welcome to Climate Quickies, bite-sized nuggets of climate goodness from our TEDxLondon experts in under 5 minutes.
In this week's Climate Curious, following on from last week's theme of climate footholds, we're talking with Bruce Bekkar, a medical doctor who's using his profession as a foothold for climate action. From OBGYN to climate advocate, Bruce shares how medical professionals are some of the most trusted folk out there and can be super powerful voices in the climate conversation. From the Green Docs podcast, here's Bruce Bekkar. Stay curious.
So we're here at TED25, and one of the things that's really cool is that you get to meet so many people who are here doing amazing and interesting and things that just really make you go, really? And one of those people I get to talk to now. So I'm joined by Bruce Bekkar, and I'm actually not even going to try and tell people about your background because it's a really interesting journey, I think. So will you tell us a bit about who you are and what you do?
I don't know how far back you want me to go.
Well, not birth, but you started out as an OBGYN, right?
Well, actually, my climate work started because of surfing.
Okay, then that's where we start. Let's do it.
Moved back to San Diego because I'd lived in coastal North County, San Diego when I went to college.
Right.
And I just fell in love with the coast there. I'd grown up going to the beach with my parents when I was a kid, but that was up in L.A., and the beaches in San Diego are much nicer.
Oh, interesting. Okay.
And so I moved back to L.A. I went to medical school. I did my training. And 2 years after I finished my training, I just realized that I wanted to be back in San Diego, so I moved back. So I was very bonded to the coast there. And in late 2006, I came home one night after a very long day in clinic, and I read an alumni newsletter from UC San Diego where I'd gone to college. They had an article from Scripps Institution of Oceanography, which is this major oceanographic research institute, world-renowned. And it was called The End of the World as We Know It, which not only the title of an REM song, it's also about this thing called global warming that I had heard of but really didn't understand at all. I read that article, again, at the end of a long work day. My entire life changed because of that article. Wow. I just felt the foundation of my life, all the things that I cared the most about, not only the people that I cared about and the patients, but also the places. The North County coast would be vulnerable to sea level rise and all sorts of other things in a way I really couldn't have imagined before I read that.
Right.
And because Scripps is such a renowned institution, I didn't question it. I accepted their findings and their predictions. Changed my life completely. Wow. And by the next night, I had gotten rid of my BMW and gotten a Prius and started doing everything I could to green stuff up. So that's kind of how it started, was with my concern for the coastline.
That's incredible.
Didn't come around to health until about 8 years later.
Right, because you are a medical doctor. And tell us about that realization when you connected, I guess, the thing that was your home and that you were passionate about to your work.
Late in 2014, going on into 2015, we were seeing more and more literature come out about health impacts. A lot of times people look at the climate crisis and they think we're just talking about superstorms like Hurricane Katrina and massive heat waves and things like that. But it's really the daily impacts that happen all the time, all over the place, that are more dangerous, and they're rarely attributed to climate change. But it's things like the fact it doesn't cool off at night nearly as much as it used to in certain places. And it's warmer than it used to be, and we have more heat waves, and they're more severe. There's more air pollution, which you can't see it, but they make people sick. So all these things are going on. And what crystallized it for me was there was a paper that came out in late 2015 from the American Academy of Pediatrics. It was the first big review of childhood impacts of climate change and predictions for what that would be in the future. And there was a quote in that article that said, from the World Health Organization, saying that 87% of disease impacts would happen to children under the age of 5. And that just shocked me and horrified me, because who's least responsible for these problems than children? So I started thinking, does it happen even sooner than that? Does it even affect pregnancy? I put a team together. It took me 6 months, but I knew enough people that were academically minded, and I found 3 other people that knew what they were doing and were concerned like I was. And it actually took 3 years, but we put a paper together looking at birth impacts. We looked specifically, and again, this was guidance from one of the researchers who was from the California EPA and had done a fair amount of publishing in this arena. But she said we ought to focus on heat and air pollution.
Okay.
Because those are daily ongoing impacts that are seen all over the place. And there was more and more research coming out. So we reviewed all the studies that had been done over the last 15 years before that were in the continental U.S. And the reason we didn't look beyond that was because there were certainly then so many people that were saying, oh, this global warming thing is fake, or if it is occurring, it's certainly not occurring here. So we didn't want people to have that excuse. So we just looked at the continental U.S. and heat and air pollution, and we didn't know what we'd find. And it took 3 years to pull the data together, probably because I'm not an academic and I'm very slow at these things, but we pulled the data together, and by the time we had it out and had it in table form and looked at it, it just blew our minds, because hiding in plain sight was clear-cut evidence that heat and air pollution tied to the burning of fossil fuels and climate change were very strongly related all across the country with preterm birth, low birth weight, and stillbirth.
Wow.
And even people who aren't obstetricians or aren't in medicine know how significant those kinds of birth outcomes are.
Yes.
I mean, they really set the course for a child's life. It's not just they run a risk of dying, it's they run a risk of major health problems in childhood and on into adulthood.
Yeah.
And so when that paper came out, it was covered by all kinds of news outlets. Joe Biden tweeted about it that night, and we've been speaking about it pretty much nonstop since that paper came out in June of 2020.
Here's my question in terms of when you're talking to people in your profession, to other doctors, to other physicians, healthcare professionals, do you feel like people know they've had the same realizations you've had, or is it something that is, they're not there yet?
It depends on the audience, and I've talked to healthcare professionals all across the country, and I continue to. I think it's a growing awareness. I think we understand, because of our training in biology, that nature's kind of like a living thing, like one of our patients, and that it is not okay to be pushing nature the way that we are right now. We're running real risks of hitting tipping points that could be disastrous. I think where the barrier is taking action.
Right.
And it is not a hard and fast barrier, but for so many people in medicine, they're already overworked. And the idea that they now have to take on, solving the world's biggest global challenge is a bit daunting. But I try to make the point that they're already involved, because once you're aware of this and you understand it, if you don't do anything about it, it takes energy away from you. Every time you get reminded of it, it makes you feel more fearful and anxious about what the future could bring. But as soon as you plug in, even in the smallest way, and I tell the docs, you just have to get started somewhere. It doesn't matter whatever your impulse is. You'll probably be doing something else 6 months or a year from now. But the moment you feel a tiny bit of agency, it will make the entire problem feel more manageable. You will plug into networks of people that are working on this issue. It won't feel quite so overwhelming to you, and it'll make the rest of your life actually feel a little less difficult.
Right. I mean, I think that's absolutely right. And I think that I'm curious to know, do you see a special role that healthcare professionals, doctors play in helping us fight this climate and biodiversity crisis?
Yes. Well, first of all, educating patients and thinking about patients a bit differently. I describe something I kind of jokingly call our waiting room problem. And the way I explain it is, if you ask a kid in the kind of upscale beach town that I live in where tomatoes come from, he just looks at you funny and says, they come from Whole Foods. He doesn't get that there's a backstory to that tomato. There's a way that was grown, and were pesticides used on that. How far was it trucked and in storage? All that stuff makes a difference in terms of the quality of the fruit and also how safe it is to eat. By the same token, I think medicine is blind, by and large, to patients, and we think everybody comes from the waiting room. We don't differentiate between the person that lives, in a nice suburb with plenty of trees and another person that lives near a freeway or in an urban heat island or things like that. So one of the big things to do is to find out what patients' environmental risk factors are, climate change and beyond, but also to integrate those into plans for care. And if we do a better job doing that, then they're less likely to end up in the emergency room or needing emergency surgery or things like that. So it's a win-win thing. It can help save us all time and money and energy. So that's on the one side. But the other side, and the work I've really been doing for 15 years now, has been on the advocacy side, because doctors and even nurses are actually more trusted, in case you haven't picked this up, when they do surveys, at least in the U.S., the only group that's more trusted within society than doctors are nurses. So doctors and nurses, just by showing up with their Sierra Club or their 350.orgs or any other kind of climate organization that's doing this kind of work, just by virtue of them being there, they add a lot of gravitas to those efforts.
Yes, that's so true.
And I try to emphasize with them, you don't need to become a climate scientist. This is not about you understanding all the facts. It's enough to see the risks and the harm that's already happening with patients and communicate that to elected officials, and you can make a big difference.
Love it. And if you want to find out more about your work, how can they do that?
You can email me at greendoc@me.com. You can look at my speaker's website, because I would like to do more speaking in the corporate world and beyond medicine. And my website is thegreendoc.org. And that'd be a good start.
You have a podcast, right?
We do have a podcast called Green Docs.
Fantastic. Thank you so much for joining us.
Thanks for having me.
Thanks for listening to this Quickie.
This episode was created by our superstar podcast team at TEDxLondon. Until next time,
Stay curious.